Assalamu alaikum. Today's article is titled Post-Treatment Apical Periodontitis. It's a histobacteriologic and histopathologic findings done by Ricucci et al. And published recently in 2026. Failure of the root canal treatment or retreatment is characterized by the persistence, emergence, or recurrence of apical periodontitis after a given period of follow-up evaluation. Previous evaluation of causes of failure of non-surgical root canal treatment or retreatment were usually based on case series or used analytical techniques with significant limitations, including the failure to perform serial sections of the biopsy specimens and the failure to preserve the original spatial relationship between the root apex and the lesion during sample taking. And to overcome these limitations, the present study was intended to report on the histobacteriologic and histopathologic analysis of large number of biopsy specimens of teeth with post-treatment apical periodontitis, for which serial sections of root apices with the attached lesions were available. The study material comprised sequential biopsy specimens of 71 human root canal treated teeth with apical periodontitis lesions. The evaluated specimens consisted of the roots or root tips with the attached apical periodontitis lesions from root canal treated teeth that were subjected to either root end resection during periapical surgery or tooth extraction. And the following clinical and radiographic data were recorded: the presence and intensity of symptoms, radiographic lesion size, sinus tract, type of intervention, whether treatment or retreatment, apical limit and quality of root canal filling, and the presence and quality of coronal restoration. And for the histobacteriologic and histopathologic analysis, serious sections were taken and every fifth slice was stained with H&D for histopathologic evaluation, and the other sections were subjected to histobacteriologic analysis by using the Taylor-modified Brown and Bren staining method. The histopathologic and histobacteriologic aspects were evaluated as follows: whether intraradicular infection, extraradicular infection, inflammation and epithelial proliferation, which is the presence and distribution of acute and chronic inflammatory cells and epithelial cells. The lesion were histopathologically diagnosed as abscess, granuloma, or cyst. Abscess and granulomas were subclassified as epithelialized or non-epithelialized, and apical cysts were subclassified as true or base cyst. The results showed that, in general, histobacteriologic evaluation revealed intraradicular bacteria in the apical root canal system of 67 out of 71 biopsy specimens, representing 94% of the total sample. And in 46 teeth, biofilms were seen inside apical ramification. And of the 4 cases that bacteria were not detected within the canal system, one presented with an extraradicular infection containing actinomycotic colonies, while the other 3 showed no bacteria in the extraradicular space either. And all these 4 cases were histopathologically diagnosed as base cyst. And of the 3 cases in which bacteria were not found anywhere, 2 exhibited severe concentration of BMNs at the apical foramen. This strongly suggests that intraradicular bacteria were actually present. They were either lost during processing or located more coronally in the canal. And the 3rd case with no bacteria showed inflammation around a large amount of extruded filling material. Overall, an extraradicular infection occurred in 26 of 71, representing 37% of the cases. In all but 1 case with an extraradicular infection, there were also intraradicular bacteria, either in the main canal lumen or in apical ramifications, or both. An extraradicular biofilm was significantly more present in cases with symptoms and sinus tracts, abscesses, large lesions, and retreatment cases. The planktonic cells or flukes in the lesion body were significantly more associated with retreatment, symptomatic, and large lesion cases. And the histopathologic diagnosis revealed that the most common post-treatment apical periodontitis diagnoses were in descending order: the non-epithelialized granuloma representing 42%, non-epithelialized abscess 22.5%, base cyst 17%, epithelialized granuloma 10%, epithelialized abscess 7%, and true cyst 1%. So, to conclude the findings of this study, intraradicular infection was the major factor associated with post-treatment apical periodontitis, and although extraradicular infection was observed in approximately one-third of the cases, in the large majority of them, it was associated and probably maintained by a concomitant intraradicular infection. As for the histopathologic diagnosis, granuloma was the most common post-treatment lesions, corresponding to approximately one half of the cases.